And LO7 will be managing health information in electronic medical record using nursing process. This will be my workflow for my learning outcome number 7, and all the information that will be included will be coming from one of my family member, and remember that his or her identity will be altered as for her privacy. So first, register the patient, type the name. Sir, what's your name?
Mark Iresio.
Make sure to fill up all relevant information to identify the patient. Then review patient's information before saving it. Then click Start Visit. Then admit the patient. Choose the location to inpatient ward. Capture patient's vital signs. Height will be 152 cm. Weight will be 60 kg. Calculated BMI is 26. Temperature is 37 degrees Celsius. Pulse is 65 beats per minute. Respiratory rate is 24 breaths per minute. Blood pressure will be 110/70. Oxygen saturation would be 95%. Review vital signs data and save it. Then click Visit Note. This contains diagnoses such as primary and secondary. Clinical note includes assessment, diagnosis, planning such as nursing care plan, intervention, and evaluation. For primary diagnosis, the patient is diagnosed with common cold and has shortness of breath. And so under this, we formulate nursing diagnosis of ineffective airway clearance. In assessment, under subjective cues, the patient stated that nahihirapan po akong huminga dahil ubo ako ng ubo. Now, to get the objective cues, we'll first assess the patient. First, monitor vital signs that will give us respiratory rate of 24 and a pulse rate of 65 beats per minute. Assess the rates, depths of respiration that will give mass RR of 24 breaths per minute. Assess hydration status, skin tergum, mucous membrane, and tongue will give us cathode thick mucus secretion. Assess lung sound that will give us coarse and crackles, which means there's an obstruction on the larger airway. As patient's comfort, that will give us facial grimace, which is evidently seen that the patient is irritable. For the intervention, we suggest the use of humidifier. Teach the patient of proper coughing and breathing. Position clients upright. Increase intake, fluid intake for 3 liters a day. Use of bronchodilators, mucolytic, and nebulizer. For the evaluation, desired outcome is that after 4 hours of nursing intervention, the client will verbalize decrease of discomfort, decrease of respiratory rate from 24 to 20 breaths per minute, decrease of pulse rate from 65 to 60 beats per minute, and absence of facial grimace. Do diagnosis and clinical note and then save it. For the health teaching, good morning ma'am, my name is Nurse Sam. First po, ipoposition po natin si patient into upright position po para po hindi po siya mahirapan huminga po. This position po will enhance po yung lung expansion and promotes po nung air exchange. Then we may also use pillows po to support patient's head and neck po while positioning the patient on a upright position. Then we will also teach you ma'am how to proper breathe, how to do proper breathing and coughing po. First po, ihinga po tayo ng malalim ng 2 beses, tapos i-hold po natin yon, then saka po tayo uubo for 2 to 3 times po. Sa ganitong paraan po ma'am, mas magiging forceful po yung pag-ubo po natin at mailalabas po natin yung mga secretion po o yung mga sipon-sipon po natin. So ayun po. Next po is we will advise you ma'am to use to drink water po. At least increase po natin ng 3 liters a day yung pag-inom po ng tubig, kasi po this will also help po para madali po nating mailabas yung mga sipon po natin, para po maiwasan po yung obstruction po, yung maiwasan po yung maging dry yung mucous membranes po natin, kasi pag nagiging dry po yung mucous membrane po natin, nagiging concentrated po yung sipon po. Pag ganun po, pag nagiging concentrated yung sipon, mas nahihirapan po tayong mailabas ito. So, we will advise you, ma'am, to drink water po. And also, ma'am, we will advise you po to use po ng humidifier. We will suggest you to use po ng humidifier. Ganito po ang itsura niya. This humidifier po will help po na ma-moisturize po yung air na nabibreathe po natin para po hindi po maging dry yung mucus po natin, mucous membrane po natin, kasi nagiging cause din po siya para maging concentrated po yung mga sipon po. So, ganun po. Next po, ma'am, we will advise you po to use po ng nebulizer or ng bronchodilator po as prescribed po by the doctor. So, ginagamit po ito, ma'am, para po ma-open po yung airway po natin o mas mapaluwag po yung paghinga natin. Then also po, ma'am, we will advise you to use po mucolytics po para po maging diluted po yung mga sipon po o yung mucus secretion para po madali po nating mailabas po yung mga sipon po.
As for reliable source, I used healthline.com, which is reviewed by Ms. Witherspoon Deborah, a PhD, RN, and CRNA.
I also used Nurses Lab as my basis for nursing care plan. This was written by Jill Wayne, which is a reliable source. We could see the credential of Mr. Jill Wayne, which is a BSN and a registered nurse.
I also use ebooks such as Nurses Pocket Guide, 13th edition, which comprises of diagnosis, prioritized intervention, rationale, written by Marlene E. Dowenges, Mary Frances Morehouse, and Alice C. Moore.
With the height of 152 cm and a weight of 60 kg, this gives us 26 BMI, which is based on CDC.gov, our Center for Disease Control and Prevention. BMI of 26 falls under overweight. Overweight ranges at 25 to 29.9. Vital signs is important as an overview of our client's status. We could see that both temperature and pulse rate are at normal range, while a respiratory rate of 24 BPM indicates that the patient has difficulty in breathing. Then, register patient's allergy if there's any. Our patients don't have any allergies. Then, click non-known allergies and then return to home. Then, add patient's appointment for follow-up checkup. We could schedule new appointment by first setting service type, a new patient of general medicine, then search time available. As we could see, there is no available time slot. So, go back home and request for an appointment. Fill in appointment type, new patient of general medicine. Fill in time frame of 2 to 3 days. We could add notes such as the patient needs follow-up checkup for further referrals and evaluation. Then, save it. Then, click home, then find patient's data if it is recorded. Then, go back to Mark Recio's profile and end visit. Don't forget to log out to secure patient's data. To rate myself on health education rubrics, both assessing health information and evaluating information sources, I scored 3. I locate general sources of health information products or services that may enhance health in a given situation. I also explains the degrees to which identified sources are valid, reliable, and appropriate as a result of an evaluation of each sources. However, the explanation does not include extensive or specific evaluation criteria used in determining validity and reliability of the appropriate sources. For source identification, I scored 3. I identified most of my sources of health information, products, or schools, community services. I usually stated where I found my sources. Lastly, on source validity, I scored 4. I thoroughly explained why all my sources are appropriate to the given health situation. My explanation is complete and accurate.